Two examples, bacteria that live in our eye, okay, Corynebacteria, okay, is the cousin of the bacteria that causes whooping cough, okay, whooping cough is very nasty, but the same bacteria that is pleomorphic. You see the floaters in our eye, okay, maybe because of this bacteria, okay, constantly. You will never see floaters that have two different shapes, I mean, that have the identical shape, I mean. They always have different shapes because Corynebacteria is pleomorphic. Corynebacteria. And then Mycobacterium smegmatis that lives in our ears and external genitals. Okay. Mycobacterium smegmatis, acid-fast bacteria. Second type of relationship is mutualism, in which both organisms benefit from each other. E. coli that lives in our large intestine provides vitamin K and B to us, and we provide shelter and food to E. coli. When you take a broad-spectrum antibiotic, what happens? You kill off E. coli, then you get diarrhea. So it's a good idea to take a pill of B complex with broad-spectrum antibiotic to compensate the loss of B complex. Okay. Parasitism. One organism benefits and the other one is harmed. Opposite of commensalism. Commensalism. In commensalism, one organism benefits, the other one is unaffected. But in this case, one organism benefits, the other one is harmed. You know some friends that are parasites, right? Yeah. Always needing something, needing something. Chlamydia. All diseases belong to this category. All diseases. Okay. Opportunistic organism. This is a category, okay, that includes organisms that under normal circumstances, they are your so-called friend. But when the opportunity is there, they will harm you. For example, good example is your own E. coli. Okay, as long as it stays in the intestine, no problemo. But your own E. coli in the bladder, excruciating pain, or if it ends up in kidneys, okay, or in brain. I want you to recall McConkey agar plate in the lab. Remember McConkey agar plate? How much acid it makes? Pink zone, right? Tremendous amounts of acid. Your bladder has thick membrane, mucous membrane that takes care of the acid. Your bladder cannot take care of that much acid that E. coli makes. Imagine that acid in your brain. No way. Okay? It can cause encephalitis. It can cause UTI. Okay? So as long as these organisms that are called our friends, as long as they stay where they belong, no problem. But in other parts of the body, they can cause problems. Or if the host is compromised, they will cause problem. Opportunity is there. Host is compromised, diabetes, HIV positive. These organisms will cause problem. Etiology of infectious diseases. Remember who introduced the idea of infectious diseases? Koch, Robert Koch. One organism, one disease. Okay. From chapter 1. But there are exceptions. Just want to refresh your memory about the exceptions. According to Koch, we should be able to grow organism on lab media. Can we do that? No. Not all microorganisms can be cultivated on lab media, as we talked about when we were talking about suspension method, right? Bacteriophages or viruses cannot be cultivated on artificial lab media. Treponema pallidum is a bacterium. Can we grow it on lab media? No. You need tissue culture to grow this. This is a parasite. Like a virus, it's a parasite. You need a tissue culture to grow Treponema pallidum. Chlamydia. microorganism, bacteria, but you need a tissue culture. All viruses, you need tissue cultures. Exception, according to Koch. Okay, one organism, one disease. Not true. Some diseases, like pneumonia and nephritis, several microorganisms can cause pneumonia. Klebsiella pneumonia, Streptococcus pneumonia, viral pneumonia, fungal pneumonia, Histoplasma capsulatum, Coccidioides immitis. Okay, they cause pneumonia. Some pathogens, according to Koch, okay, Bacillus anthracis causes anthrax. One organism, one disease, right? Now we know that one organism, such as Streptococcus pyogenes, can cause. Okay, name the 3 diseases, please, that it causes. The most common is strep throat, rheumatic fever, and arthritis, rheumatoid arthritis. Not any part of the Streptococcus pyogenes is the cell wall that induces, cell wall of this bacteria that induces rheumatoid arthritis. Strep throat, rheumatic fever, endocarditis, and arthritis. Now, classification of diseases according to their occurrence. How often do they occur? Some diseases are sporadic, and the examples that I have listed here, they are in the United States. In other parts of the world, they may belong to some other category. For example, typhoid fever in the United States, it belongs to sporadic category. In Asia, in some parts, it may belong to epidemic category. Malaria in the United States, it belongs to sporadic category. In Africa, it is epidemic. Okay? Lyme disease is another example of sporadic. What else would you put sporadic in the United States? What other disease? Sporadic. Tuberculosis in the United States is sporadic. Asia, tuberculosis is epidemic. Okay? What else? Which yellow fever? Yellow fever is sporadic. Yep. One more, and then we'll move on. Sporadic. Sporadic. Amoebic dysentery. Sporadic. Amoebic dysentery. Sporadic. Endemic. A disease that is constantly present. Some people in the population, they always have that disease. Cold, common cold. Yeah. Okay. How about STDs? Can I put STDs here? Yep. STDs, most STDs belong to this category. Endemic. Okay. All right. Epidemic. Now, epidemic, in the United States, we don't have, at least I have not witnessed any epidemics in the past 30 years. We do a very good job of regulating epidemics in the United States. But we have had epidemics in the past few years, bird flu, okay, SARS, okay. Chickenpox epidemic? Not epidemics. Not large enough. Maybe 100. Endemic, maybe. Yeah, endemic of, yeah, sure enough. Endemic constantly. That is, epidemic has to be thousands of people. Thousands of people. Yeah. Yeah, large population. Yeah, sure. Epidemic, no, really. I know in Midwest a few years ago, some high school kids in Midwest, they gave STD to each other on purpose. It was on ABC. Yeah, so that's crazy high school kids. So they tried to spread it Yeah, really, I don't know the but rationale behind them. Yeah. Influenza. Okay. There's a new strain of influenza going on in China right now. Epidemic proportion. Yeah. Bird flu, SARS, influenza. Yeah. AIDS, definitely epidemic. AIDS. Nah. Yeah, they control it. They do a very good job, although it happens quite frequently on cruise ships. Yeah, but not to epidemic level. Yeah, a few hundred people get it, but no. AIDS is epidemic, definitely. Not only epidemic, it is actually a pandemic. Several countries, several African countries are involved. So pandemic, an epidemic that is worldwide. Pandemic. What else is pandemic? Malaria. Malaria is definitely pandemic. And I will also put TB. TB. And one more disease that is coming back, which is, I'll put in sporadic, is polio. Polio is coming back, which is sporadic. Sporadic. Yeah. Sporadic in Asia country and African country. Yeah. Okay, another criteria to classify diseases according to their severity or duration. Acute disease. Not acute disease, but acute disease. Okay. A disease where the sign and symptom develops rapidly, stays with the host for a short period of time. Short period of time is defined as what? 6 months? Max 2 weeks. 2 weeks max. 2 weeks. Okay. Somebody, is that right? 2 weeks? Yeah. You don't know?
Like if it's more than 6 months, it's chronic. Yeah. And less
So,
than 6 months, it's acute.
Less than 6 months? Less than 6 months is acute? Okay, and then I'll change my definition because she knows more. Okay, change it to less than 6 months, please. Okay, yeah. Okay, I have to listen to her. Sorry. Okay. Sorry. Less than 6 months. I stand corrected. Okay. Less than 6 months. Okay. Okay. All right. So, chronic disease. Okay. Starts slowly and stays with the person for months or years or for the rest of their life. Tuberculosis, syphilis. Yeah. Third category has only one disease. Okay. Sclerosing panencephalitis. Now let me break it down for you. What does that mean? Sclerosing is hardening. Sclerosing. Pan. Remember Pan Am? Pan mean frying pan, round. Like Pan Am airline, that's no more. Okay, pan, round. Encephal, membranes of the brain. Itis, inflammation. You can call this person hard-headed, literally hard-headed person. Sorry, but that's what it is. Yeah. No one disease that belongs to this. No other disease that belongs to this category, unless the doctor can tell me. Samreen? No? Is there any other disease that belongs to this category?
I don't know about self-esteem.
Yeah, okay. That's the only one that I could find. Okay. Sclerosing panencephalitis, okay, caused by a virus. Okay. Latent disease or latent phase. Okay. A disease characterized by, no, this is actually a phase, it's not a disease. It's a carrier phase where there are no signs and symptoms. Shingles, HIV, AIDS, not HIV, AIDS. Okay. Exactly. Yeah. It's actually silent, no signs and symptoms. Okay. Yeah. Chickenpox? Shingles, yeah. Chickenpox is, yeah, it remains silent, dormant. Yeah. Yeah. Spread of infection. Spread of infection. Okay. Why not spread of disease? I'll use the word infection. You all go to the cafeteria here, okay, and eat green salad. Okay. And the salad is contaminated with, let's say, E. coli and salmonella. Do you think all of you will get sick? No. Not necessarily. Yeah. Some of you may have been exposed to that salmonella or E. coli previously, and you may have developed immunity, right? Okay. So spread of infection, spread of pathogen, spread of pathogen. You may not all get diseased, sick. Okay. A reservoir. Any source could be living or non-living. Okay. Could be your doggy, could be your little turtle, could be your boa constrictor. Really? Yeah. Really? Sure. Could be anything. Yes.
I have a question. I see some people who have pets like dogs, cats, and animals.
Yeah.
The animal basically they're kissing, they're licking with their tongue.
Yeah.
So isn't the normal flora of those animals different from normal flora of human, and it could cause disease in human beings?
If the dog is healthy, they are immunized and all that, it's fine. I actually just did a project with honors chemistry class, and they went to veterinarian's office. They got saliva from dogs and cats and human. Dogs and cat saliva is much stronger than humans, so really, so it's fine. Although cats and dogs, lick their, what? Okay, it's just fine. It's no problem. Okay. Pardon me? Yeah, it is. Their lysozyme is much stronger than humans because they have to chew bones and all that. So it is fine. Yeah, I did not find any abnormal microorganism in their mouth. Pardon me? Aesthetic? Acidic? No, not acidic. Not at all. No. Yeah. Yeah. But lysozyme is much stronger. Lysozyme. Yeah.
It's true when they say human bite is worse than dog bite. When they say they mean more infectious.
Possible. I believe that.
If you get bit by a cat, though, they release enzyme into your skin because they kill rats and stuff.
Yeah.
That is so strong it will give you an immediate infection.
Yeah. Humans are more vicious than dogs. Yeah. You can use your own imaginations here. All right, human reservoirs. AIDS, you imagine it and we transfer it. Okay, AIDS, typhoid fever, diphtheria, amoebic dysentery. Which part of the human body is responsible for transferring the most germs? Oh, bye-bye. Yeah, you're right. Fingers, hands. Write it down, please, on the test. Which part of the human body is responsible for transferring the most germs? Animal reservoirs. Your little turtle, your animals. Okay. If you live in Parkland or Coral Spring, you have seen the size of those raccoons that get into your trash, and you get the broom and you go outside, and he's standing right next to the trash can with his on his hind legs. So what are you going to do? He's just waiting for his own broom. Really. So, they're not afraid of you, really. So you can get these diseases from domestic animals or wild animals, so you have to be careful. If you put your little turtle on your hand and just pet it, put it down in his little bathtub or whatever, and don't wash and sit down to eat, you'll get food poisoning. You must wash your hand. salmonella, okay, salmonella. Or you have this boa constrictor around your neck, petting it. You must wash your hand. They have salmonella, all that. So, okay. Alrighty. Non-living reservoir, the two most common non-living reservoir, because you find the spores, fungal spores, bacterial spores, where? Soil. And the dust blows everywhere, okay? And the food industry, they use this in the water, okay, to prepare our food, soup and all these things. So if you go to grocery store and there you find these big cans, they look pretty swollen, okay? 10 for $1. Don't buy them, please, okay? Swollen cans, never buy swollen cans, because botulinum toxin is tasteless, okay, odorless, and heat resistant. Even if you cook it, you cannot taste it, okay? And you, oh, when the bacteria, the spore, under anaerobic condition, when they seal it, okay, the spore survives, and it starts to germinate under anaerobic condition, and it starts to make gas. So, and when you cook it, okay, the heat, the bacteria is probably dead. Toxin is heat resistant. It will survive, and you will be in ER in less than half an hour.
So it's the actual
Toxin, yeah. Not the bacteria. Bacteria is long gone. Yep. Yeah.
It's better not to eat canned food at all. Doesn't it have preservative nitrite, something which is cancerous?
Yeah. Well, absolutely. Yeah. Try not to eat any canned food at all. Yeah. Nitrites are bad for your heart. They are cancer causing too.
And the deli meats.
Yeah, deli meats too. Yeah, preserved. Any preserved food. Nitrites are no good for you anyway. Yep. Yeah. So I told you, living is very hard nowadays, really. Yes. Yeah. Yeah. All right. Transmission of infections, mode of transmission of microorganism to humans. Three major ways: contact, direct contact, person to person, kissing, hugging. Can you get AIDS from kissing? Let's hear from you. Okay.
The mouse is covered by epithelium and genitalia is covered by epithelium too.
Yes.
I need to do a research on that. How come kissing are is it the saliva?
One, you have to swallow 1 gallon of saliva to get AIDS. 1 gallon.
What about an overnight?
At once. Overnight kissing contests, right? Really? If you have blisters in your mouth, open sores, exceptions, yeah.
On an average, how many gallons of saliva does a person produce per day? A lot.
How many gallons produces? I do not know. It is unlikely to get it through that method. Yeah, kissing, yeah.
I forgot, but in physiology, the volume was so surprising. We don't realize, I think it's more than a liter or something.
Yeah, liter, yes, not a gallon, yeah. Yeah, we do produce a liter or something, but not gallon. Yeah. Yeah.
It's a lot. It's more than a liter.
Liter or something like that, but not a gallon. Yeah. 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 Yep. How about hugging? Can you get a disease? Name a disease that you can get from hugging someone. Bear hug. Huh? Yeah. Cold. Scabies. Ringworm. Yeah. Ringworm. No. Right here. Person to person. Yeah. How about a fomite? B. Fomite. Anything that makes foam is called fomite. No. Okay. No. Anything that's small, non-living, fork, needle, stethoscope, okay, knife, those little things, pencil, pen, okay, Someone has thrush, they're chewing on their pencil. You borrow their pencil, now you have thrush. Okay. Okay. Exactly. Yeah. So a fomite, small inanimate object, little thing. What if it is small living thing like mosquito or tick or something? What do you call that? Vector. Vector. Living thing is vectors. Yeah.
So like fomites, like when you're cutting, like when you're frying like chicken for meal, and it's like someone gets on the knife.
Exactly. Right. Yeah. Or people share needles, right? Fomites.
So which one does TB?
Pardon?
Which one does TB fit into?
Oh, TB will be, we are coming to that. TB could be two, either droplet, sneeze, or airborne. If it travels more than 1 meter, that's airborne. Yeah.
Does it stay? Will it stay in the air circulation?
Depends. It cannot really travel more than 1 meter. Yeah, really, for that long. Yeah.
So you can just out of a seed, if you're contained in say a 6x6 area.
Great chance. Very good chance of getting TB. Very good chance. Yeah. Droplet, sneeze or cough. A sneeze. Yeah, let's see sneeze. I don't know what the heck he is doing, but yeah. Yeah. What's the proper way to cover your sneeze? There you go. Yep. What kind of sneeze is that? Yeah, that's the proper way to sneeze. Yep. Yeah. Holy mackerel. That's not a sneeze. It's coming out from his mouth.
Yeah, that right is stopping from the
Okay, fine. That's good enough. All right. So let's go
Is
to
that how the flu is transmitted via sneezing and coughing?
who?
The flu? Is that an influenza spread?
Mm-hmm. Mm-hmm.
Any other ways can you do it?
Touching. 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 Sure. Yeah, absolutely.
How about TB? I guess it doesn't have to be through the air.
No, you can pick up by touching too. Yeah, sure.
How long does Hep C last outside the body?
What? A sneeze?
Hep C.
Hep C. Hepatitis C.
Those last a lot longer than AIDS.
Yeah. Let me find out. I don't know, David. Yeah, I'm sorry. I don't know. Yeah. Common vehicle transmission. When pathogens are transmitted to a large number of people, okay, that is called common vehicle transmission. The whole water supply of a city is contaminated. Like one time, I think 10, 15 years ago, city of Milwaukee, water supply was contaminated with Giardia lamblia. Half of the city had diarrhea because really. So, yep. Because their water supply was unable to remove the cyst of Giardia lamblia.
Would that also, a number of years ago when like aspirin, like Aglo or something was infected, and a bunch of people got sick because there was an infected, contaminated dose of like bear or something? Would that be the same? Thing?
Absolutely, absolutely. Like This was at a minor level, but I think someone dumped a dead body in the hotel up there. And hundreds of people may get in California. I don't know if you heard that or not. So. Yeah, reservoir up there, yeah.
How similar are the symptoms between Giardia and cryptosporidium?
Same, similar. Yeah. Yep.
What is a nosocomial?
Well, I'm coming to that. Nosocomial is when you go to the hospital, and let's say I went there to get my gallbladder removed, and I picked up pneumonia while I was there. So pneumonia is nosocomial. Yeah.
But how do you know? I mean, that always got, how do you know when that came from the hospital?
Because before I didn't have pneumonia when I was in hospital, so they gave me pneumonia. Yeah, I did not have pneumonia when I went into the hospital. I acquired it while I was there. So any disease that happens during hospitalization is considered nosocomial.
What do you do with that? Do you notify the hospital?
They make a note of that. They record it. They're supposed to keep the data of that. Yeah, and they are supposed to release that data. Yeah.
Isn't that the most common thing to pick up in the hospital?
What, pneumonia? It's actually UTI. Yeah, UTI. Yeah, because of the catheterization. Most people that undergo surgery, some kind of surgery, they are catheterized, and it's just because of lack of paying attention. Okay, really, the person who's putting the catheter in, they don't pay attention, and they just touch the perianal area of the patient's own. They accidentally transfer patient's own E. coli into their bladder. UTI.
Are they always worse than a normal infection like pneumonia? Was it worse than other types of pneumonia?
You can't really say that, really. Yeah. Pardon me?
So that's why most of the patients that come in are immune compromised anyway. So they have some kind of infection, say a cancer patient coming in to be treated. So anything that they come across, they're more susceptible. So when they come to the hospital, it's just a natural occurrence that
You're more susceptible. Yeah. Yeah.
I mean, that's where, because we get preached to at work all the time about the mother that's being taken away because of hospital required infection.
Yeah. Sure. Fawzia?
Nosocomial infections, they are more resistant to treatment with antibiotics because they have been exposed in the hospital environment with antibiotics
True.
and also antiseptic. So that's why when you acquire an infection from the hospital, it's very hard to treat compared to getting infection from outside.
Is that
True.
Like, are they breeding, infections that can be worse than normal out of the hospital? It sounds
True. Absolutely. True. It's not a good idea to use antibacterial things all the time. People using antibacterial everything at home. Antibacterial shampoo, antibacterial soaps, antibacterial dishwashers. Not a good idea. Try to avoid them actually. Yeah, not a good idea. Antibacterial clothes, antibacterial pens. It's crazy, really. Crazy. Yeah. So what happens when you kill off all the bacteria? They are going to fight back, and you will have super strains. Really.
selecting for that strong bacteria.
Exactly, they will fight back. Yeah. Airborne transmission, the difference between airborne transmission and droplet is just the distance that they travel. If it is less than 1 meter, it is droplet. If they travel more than 1 meter, it is airborne. Two, sorry. Q fever. Anybody remembers the etiology or the name of the organism that causes Q fever? From chapter 1, long time ago. Coxiella burnetii. Coxiella burnetii. This is the cause of Q fever that causes inflammation of the lymph nodes. And histoplasmosis, like fungal TB, histoplasma capsulatum that lives in droppings of the bats and other birds. Now the nosocomial infections acquired during hospitalization. This number can easily go up to 30-35% for many of the hospitals in South Florida. Urinary tract is the most commonly infected site because of the catheterization, and the two most common bacteria associated with non-surgical procedures are Pseudomonas aeruginosa and E. coli. Oops, sorry. What did I just do? No. Shoot. All right. Please. Okay. Staph aureus is the bacteria that is most commonly isolated from surgical wounds. Tracy, you were telling me about this, right? After 1 year? How long after your surgery they isolated it?
Oh no, I had the skin cancer removed about a month ago.
After a month?
My arm.
Yep.
And then after they removed the sutures, is when the infection
Came back?
started.
Oh, nasty.
I mean, it's okay.
Yeah. What's the criteria for a pathogen to start disease? Okay. Determinants of infectious disease. In order for a pathogen to start disease, cause disease, here's the criteria. Number one, the organism should be able to be transported to the host by one of the methods we talked about: air, water, droplet, any of the methods. And then pathogen should be able to attach to the host, invade the host, and then multiply. After multiplication, it should be able to escape the defenses of the host. Staph aureus, for example. Okay. What are the defenses of the skin? How will it cause skin infection, disease on the skin? The first defense of the skin is healthy skin, right? Unbroken skin. Unbroken skin. We have sebum, saturated fat on the skin. We have lysozyme on the skin, right? Those are all the defenses. So in order to cause disease, we should have broken skin. It should be able to penetrate into the deeper tissue. So once it is in the deeper tissue, then it should have some kind of bazooka to cause disease, some kind of enzyme, some kind of toxin to cause disease. So Staph aureus has different types of mechanism to cause disease. On the skin, it has an enzyme, okay, that dissolves the tissues actually. The tissues are connected with the help of an enzyme called hyaluronic acid. Okay? So this bacteria, Staph aureus, it produces the enzyme hyaluronidase, which literally dissolves the tissues. Also, if in those ladies who use tampons but not very hygienic, it can actually kill them. Well, how did she die? She was just nasty. Sorry, really. Some ladies, okay, some ladies they just forget to change tampons. Really, and they die. Okay, it's called toxic shock syndrome. That's what it is, because Staph aureus produces a toxin that is absorbed into the epithelial layer, and okay, sorry, okay. And it also produces a toxin that is released in, because you know Staph aureus is halophile, right? It can grow up to 15%. Excuse me. 15% salt. We have grown it in 7.5% salt. But this semester I'm doing another experiment with my BS class. when we are conducting an experiment, and we have taken it all the way to 25%, but it doesn't grow in 25%, but up to 15% salt. So it tells you when you prepare your potato salad is highly salty. If you don't refrigerate it, what kind of bacteria will grow in it? Staph aureus. You must refrigerate it properly, or you will have staph, and it will grow in it and make toxin. It can cause food poisoning. So it depends where it will grow, on your skin or in the female private parts or in your potato salad. It has different types of bazooka to cause damage. Okay? So different, like Clostridium botulinum, how does it cause disease? Botox. Botox is a neurotoxin. When it is injected into the wrinkles, it numbs the wrinkles and people lose wrinkles. But when you eat food that has poison in it, it's a neurotoxin. It takes you to ER. Okay? Different organisms have different types of mechanism to cause disease. Sure.
What's also they use to treat women's skin, etc. Is it weak since the person's system? Is it
Harmful, very harmful. Okay. One of the doctors tried to make his own Botox. Did you see his face? Yeah. Bad idea. Bad idea. Yeah.
Those two people that were paralyzed, a few years ago in Florida, they were almost killed.
Yep. In wrong hands or injected by the wrong person, it could be a very bad thing. Yep. Yeah. Last topic of this chapter 14-15 is, how much time I have? Hold on. Okay. Okay. Development of disease, phases of a typical disease. The first phase of a typical disease is called period of incubation. This is the phase in which the pathogen is introduced into the host by eating contaminated food, from the bite, inhalation, or by any of the other methods. If we take the example of Lyme disease, this is when the deer bites the host. Deer tick bites the host, okay? The deer tick bites the host, and the organism is what? Borrelia burgdorferi is introduced into the host. So what will happen? A milder